Hi everyone, it's Alina. Today we're talking about a surprising topic, eggs. While eggs are a breakfast staple for many and a great source of protein, they can actually be harmful to some people. That's right, you heard correctly. So if you're dealing with certain health conditions, you might want to think twice before digging into that omelet. In this video, we'll be discussing 5 health conditions that might require you to limit or avoid eggs altogether. Now don't worry, I'm not here to scare you or tell you to completely eliminate eggs from your diet. This video is all about making informed decisions about your health. Remember, every person is different, and what works for one person may not work for another. If you have any concerns about your diet or how certain foods might be affecting your health, it's always best to speak with a healthcare professional. They can provide personalized advice based on your individual needs and medical history. Let's start with the most obvious one-egg allergy. Just like with any food allergy, some people can have an immune response to proteins found in eggs. This can manifest in a variety of ways, from mild symptoms like hives and itching to more severe and life-threatening reactions like difficulty breathing and anaphylaxis. If you know you have an egg allergy, avoiding eggs and egg products is absolutely crucial. Always read food labels carefully, as eggs can sneak into the most unexpected places. And always carry your epinephrine auto-injector, just in case of an accidental exposure. It's better to be safe than sorry, right? Now, if you experience any unusual symptoms after consuming eggs, even if you've never had a problem before, it's important to see an allergist right away. They can perform tests to determine if you have an allergy and advise you on how to manage it. Eggs have gotten a bad rap when it comes to cholesterol. It's true that one large egg contains about 186 milligrams of cholesterol, which is a significant amount. For years, we were told to limit our cholesterol intake to prevent high cholesterol levels in our blood. While dietary cholesterol does have an impact on blood cholesterol levels, it's not as straightforward as we once thought. For most people, saturated and trans fats have a much greater impact on blood cholesterol levels than dietary cholesterol from foods like eggs. However, if you already have high cholesterol or a history of heart disease, it's still a good idea to be mindful of your egg consumption. Talk to your doctor or a registered dietitian. They can help you determine the appropriate amount of eggs you can include in your diet based on your individual health status and risk factors. Now let's move on to diabetes. Some studies have suggested a potential link between frequent egg consumption and an increased risk of developing type 2 diabetes. The exact reasons for this link are still not fully understood, but it's thought that the high cholesterol content of eggs might play a role. Additionally, some studies suggest that eating eggs every day might affect glucose metabolism and increase insulin resistance, both of which are risk factors for type 2 diabetes. However, it's important to note that more research is needed to confirm these findings and determine a definitive cause and effect relationship. If you have diabetes or are at risk of developing the condition, it's a good idea to talk to your doctor or a registered dietitian about the appropriate amount of eggs to include in your diet. They can provide personalized guidance based on your individual health status and needs. For those of you dealing with gallbladder problems, eggs can be a bit tricky. The gallbladder is a small organ that stores and releases bile, which helps with digestion, especially the breakdown of fats. Eggs are relatively high in fat, and in some individuals, consuming fatty foods can trigger gallbladder contractions, leading to pain and discomfort. This is especially true for people who have gallstones, which are small, hard deposits that can form in the gallbladder. If you experience gallbladder pain after eating eggs, it's best to avoid them for a while and see how you feel. You might also want to consider keeping a food diary to track your symptoms and identify any potential triggers. Last but not least, let's talk about kidney disease. Our kidneys play a vital role in filtering waste products from our blood. When our kidneys are not functioning properly, these waste products can build up in our body, leading to serious health problems. People with kidney disease often need to follow a special diet to manage their condition. This diet typically involves limiting certain nutrients, including protein. Eggs, being a good source of protein, might need to be limited or avoided in some cases of kidney disease. If you have kidney disease, it's crucial to work closely with a registered dietitian to create a meal plan that meets your individual needs and helps protect your kidneys from further damage. So there you have it, 5 health conditions where you might want to think twice about reaching for that extra egg. Remember, this video is not meant to replace medical advice. If you have any concerns about your health or how your diet might be affecting you, please consult with a healthcare professional. They can provide personalized guidance based on your specific situation. If you found this video helpful, please give it a thumbs up and subscribe to my channel for more informative videos on health and wellness. Don't forget to share this video with your friends and family. See you in my next video.